Many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old.
Okay, where do we start? It's getting harder to figure out where to start. I'll start off by saying that in my clinic, I treat hundreds of children on the autism spectrum because oftentimes they have challenges with sleep. It is by far the most common patient profile that I see. And these kids and their families are absolutely amazing. And in many cases, we know the cause for why they have autism. It's no mystery at all. Because as it turns out, there are thousands of causes of autism. We know a lot of the causes lie in the genetic realm. So if you have a genetic disorder such as Rett syndrome or tuberous sclerosis or Down syndrome, these children are predisposed to developing comorbid autism. We know that there are a whole host of single genetic changes that can also predispose you to being on the autism spectrum. If you go to GeneDx, which is a common genetic testing company we use, their autism panel lists many, many, many genes that they test for that are shown to lead to or predispose to autism. But we also know extreme prematurity, being born extremely low birth weight, having a congenital infection that affects the brain, having structural changes to your brain. All of these things can also predispose you to developing autism. But what about kids where we don't have an answer or a clear diagnosis for why they are on the autism spectrum? Well, it turns out we suspect that most of them probably also fall into the genetic realm. For example, depression. We know that if you have a family history of depression, you are more likely to develop depression. Does that mean there's a single depression gene that you can identify? Well, no. We think it has a polygenic inheritance, which means there are likely hundreds of different genes when combined in just the right way predispose you to developing depression. None of these genes in and of themselves are considered mutations or abnormal. They're part of normal variation that we see in human beings, which is why all of us are different because we all have variations in our genetics. But when they combine in just the right way, they might predispose you to certain conditions like depression or anxiety or autism. And of the thousands of things that we know cause autism, there are two that we know certainly do not. One being vaccines, because it's been thoroughly studied. And we know that parenting style does not influence the risk of autism. And when I say develop autism, I don't mean that it suddenly comes along one day, they're fine one day, and the next they have autism. They likely had autism all along, but they grew old enough such that they now are developmentally at the age where you can actually diagnose them with autism. The whole notion of a child that's developing completely normally and then suddenly regresses into an autistic state is actually an exceedingly rare form of autism spectrum. And even that likely lies in the genetic realm. But many families will tell you from day one they knew something was unique about their child. All of my patients are unique from one another and absolutely wonderful.